Of all of the arthritis consumer groups and patient groups here in Canada, I'm really thrilled to, on behalf of the Arthritis Broadcast Network, be at the Canadian Rheumatology Annual Scientific Meeting. I'm here chatting with Dr. Diane Mosier, who is the Division Head of Rheumatology at the University of Calgary, and also, very importantly, is the co-chair of the Models of Care Committee of the Arthritis Alliance of Canada. So we're thrilled you've taken a few minutes of your valuable time, Dr. Mosier, to speak with us, and I guess welcome.
Thank you. Welcome.
Yeah, exactly. We're really thrilled to have you here just for a few minutes to ask you a couple of things. Really, one I think we want to start out with was, I know the meeting is just beginning, but for you as a rheumatologist who practices and sees patients every day, what sort of are you most excited about?
I think that I'm most excited about the fact that we had a meeting this morning again on the models of care for the Arthritis Alliance. That the document is complete today, so we actually, the 6 steps to a perfect model of care, that's an important step, and an important step in that we have this implemented in all the provinces in Canada that will hopefully improve the care for patients with arthritis.
Fantastic. Congratulations.
Thank you.
Yeah.
Yes.
It takes the gestation period for an official document is a long one.
It's a long one, yes,
Yeah.
exactly. I think too, one of the other important things we're looking at, we created a care pathway, and within that patient care pathway, there would be a section that we're going to be developing, which would be tools that would be specific patient-related or consumer-related tools along the way that you could find within that care pathway. So that is a project that we decided to get underway, and that will be rolled out hopefully by next year.
Fantastic. I think that's one area that we really haven't had, and that is when you're diagnosed with arthritis, it can be very, very difficult to find your way through the healthcare system. Because one, when you're diagnosed, you don't know that much about it. And we really rely on our physicians to help us along that educational pathway. But if the healthcare system itself could help better guide us, we'd get to wellness, we think, that much more quickly. So that sounds great. Lastly, we know you've got to run off to a scientific session, but we wanted to ask you, from your own practice perspective, so seeing patients every day, what's sort of the most exciting advance you've seen recently, and do you think you're anticipating seeing at this meeting?
Clearly since I started practicing medicine, the outcomes are entirely different for patients with arthritis.
So outcomes, you mean what? Things that get better.
So much better.
Okay.
People are doing so much better. I think the most exciting thing is seeing patients early, getting them diagnosed early, treated early, and that people are just doing so well.
Yeah.
I think one of the important pieces is going to be looking at the impact in the workplace itself. That we know that it's not just disease activity that has an implication in the workplace. So how can we address that, and how can we keep people active and involved in work?
Okay, fantastic. Well, we want to thank you very, very much. We know that you're a font of knowledge and could sit here with us for hours helping to educate those that are viewers of Arthritis Broadcast Network and one of the members of the Alliance Community Organization. So we're very appreciative of your time and expertise, and just keep working for cures. That's all we've got to say. Make it go away.
Thank you, Cheryl.